Hello, I'm Dr. Mickael Jasin, and I'd like to introduce you to the Dermablate Erbium-YAG laser system from Escalent Meditech. During the evolution of laser skin resurfacing over the last few years, it has become evident that the Erbium-YAG wavelength of 2,940 nanometers is optimal for laser skin resurfacing and lesion ablation due to the fact that it is absorbed 10 times better by water than the CO2 laser. This improved tissue absorption allows for more efficient vaporization and much less thermal injury. And because of this, the Erbium-YAG laser has many advantages for the patient over the CO2 laser.
I would like to outline for you the advantages of the erbium laser. Reduced anesthesia. Many times erbium laser resurfacing procedures can be done under topical anesthesia alone. Shortened healing time. Most Erbium-YAG laser patients will epithelialize within 5 to 7 days versus the 7 to 10 days required for CO2 laser resurfacing. Reduced erythema. Frequently, the erythema experienced by our patients has resolved within the first 2 weeks. Sometimes it may take as long as 3 to 4 weeks, but the amount of erythema experienced by the patient is much less than that seen in CO2 laser resurfacing. Safe to use off the face. The erbium laser is able to resurface skin off the face in a variety of areas, including the neck, upper chest, dorsum of the hands, and even the extremities. Lesion ablation can be performed on almost any part of the cutaneous system. Able to treat darker skin types. The erbium laser is more consistent when treating type 4 skin and can be used for type 5 and type 6 skin, which are contraindicated for CO2 resurfacing. Retreat more rapidly. One can retreat an area 1 month after the initial treatment with the erbium laser versus the typical 6 to 12 months for the CO2 laser, dermabrasion, and chemical peels. We have found that many times erbium laser resurfacing can be done with just topical anesthesia. EMLA cream has been the most commonly used topical anesthetic to date. This demonstration illustrates the application of EMLA for a full-face procedure. It is important that the EMLA be first applied at least 1 hour prior to the procedure, with a reapplication after 30 minutes to improve penetration into the skin. As you can see, it is recommended that the EMLA be applied quite thickly so the skin cannot be seen through the EMLA. Once the EMLA has been applied, then occlusion with a material such as cellophane is used to improve penetration into the skin. I have also found it helpful to supplement this with an oral sedative such as diazepam and an analgesic such as hydrocodone to decrease patient anxiety. There are still those who may require IV sedation, but we have had many patients undergo a full-face procedure with EMLA cream anesthesia alone. A newer agent known as betacaine LA has recently been used, and we have found that this may provide superior anesthesia to the skin. The betacaine LA also requires a shorter duration of application. It is important that all normal laser safety precautions be taken, including appropriate eye protection for both the patient as well as staff. This demonstration will be a case of resurfacing the forehead and periorbital region. We are using EMLA cream as an anesthetic. When doing this procedure under strictly topical anesthesia, it is always best to start off with a very small area to let the patient experience the sensation of the laser as well as the noise associated with this procedure, as there is a photoacoustic effect which takes place as vaporization occurs. We have found it helpful to work in small zones and take all passes at once when using just topical anesthesia to be able to take advantage of the maximal effect of the anesthetic. We find working in these small zones improves patient tolerance. I have also found a two-handed technique to be the most reliable, as steadying the hand holding the laser with your opposite hand makes for more of an even movement of the laser beam over the skin. Please note that I will also typically change direction from one pass to another, as this helps avoid skip areas which may become more evident after the epithelialization takes place. After using the 5mm spot, I will then go back and sculpt individual lines with a 3mm spot using 400 millijoules energy, or the 1.6mm spot with 100 to 200 millijoules. Punctate bleeding is not a problem because it can be easily controlled with topical adrenaline. Over the eyelids, an assistant is apt to retract the lid using a moist cotton-tipped applicator stick. I usually take 2 to 3 passes over the eyelids using 1200 millijoules energy and a 5mm spot. You will note there is no significant char associated with this procedure and no need to wipe away debris between passes. At times you may see some vaporized epithelium adhering to the skin, but this is gently wiped away, making for a no-touch procedure. For the lower eyelids, a moist applicator stick is again used to retract the lids. 2 to 3 passes are taken over the eyelid with a 5mm spot and 50% overlap for each pass. A change in direction from pass to pass avoids skip areas. Around the periphery, I gradually diminish energy. This allows for blending from the treated to the untreated areas and avoids a line of demarcation. The crow's feet area will typically receive additional passes to further reduce rhytids in that area. Again, note the feathering technique by diminishing the energy and also making an uneven line which is less easily noticed by the observer. The following are a series of pre- and post-operative photographs showing case studies of erbium laser resurfacing. I think they very nicely demonstrate the fallacy that the erbium YAG laser can only be used for lighter lines and more superficial skin problems. I have found in my experience of approximately 300 cases that results using the erbium laser for resurfacing equal or exceed what I was able to achieve with the CO2 laser. The reduced thermal effect allows one to ablate to a deeper level into the dermis and treat deep rhytids. The Dermablate erbium YAG laser comes as a 1.2 joule system or as a 2.0 joule system. The touchpad of the 2 joule system allows the user to preset up to 5 sets of parameters. This facilitates changing parameters for different spot sizes or for feathering the margins of the treated area. The frequency and energy per pulse can easily be changed with the touch of a finger.
In summary, the erbium YAG laser from Escalep Meditech can provide the physician with a reliable method to not only perform laser skin resurfacing and lesion ablation, but also to help build a cosmetic practice, as it has with me. I believe you will find the characteristics inherent to this wavelength to be beneficial to the patient and physician alike.
Escalep Meditech offers a variety of laser systems. The Dermablate laser systems have 5 optional handpieces, including the unique Team technology that removes ablated tissue through the handpiece. Escalep Meditech also offers the Ruby Star hair removal systems with the unique EpiCheck skin evaluation system and the Pro Yellow Plus combination green and yellow system, which removes vascular, pigmented, and solid lesions.